How would you treat this malocclusion? An 11-year-old Caucasian female presented for routine orthodontic treatment after having interceptive orthodontic treatment to facilitate the eruption of impacted and ectopic maxillary canines. The interceptive treatment consisted of the removal of deciduous teeth and exposure and packing of the palatally impacted maxillary canines 12 months prior to the beginning of orthodontic treatment. The patient's parents were seeking to have her bite corrected, the diastema space closed, and her dentition set up to allow for the eventual replacement of the missing maxillary left lateral incisor. The facial evaluation showed a tapered face with lips that are slightly apart at rest. The patient has a mild facial asymmetry with the chin point off slightly to the left. Although the dental midlines are coincident with each other, they are both off to the left of the facial midline. The patient's molar relationship is class 2, 4 millimeters on the right side and 3.5 millimeters on the left. She's in the late mixed dentition and has minor mandibular crowding. The deciduous second molars and E-space are still present. The maxillary left deciduous lateral incisor is retained while the maxillary right lateral incisor is undersized. The left maxillary canine has erupted into the palate. The right canine has not erupted. The maxillary midline is deviated to the left based on the maxillary midline Ref A. Although the maxillary anterior segment is deviated, the molars in the maxillary and mandibular arches are symmetric within the arch form. The slightly asymmetric class 2 molar position can be attributed to the mild mandibular asymmetry. There is a mild curvus B in the mandibular arch, and the overjet is 6 millimeters. The Panorex shows the remaining deciduous molars are ready to exfoliate. The patient is missing her maxillary left lateral incisor. The maxillary right canine is impacted, but the long axis is vertically oriented. Her maxillary right second premolar appears to be erupting lingually. The lateral cephalogram shows ideal overbite and overjet. This does not agree with the clinical findings of a 6 millimeter overjet, so the tracing of the lateral cephalogram was corrected for the mandibular anterior positioning. Overjet was set to 6 millimeters. The cephalometric relationships are as follows. A and B is 6 degrees, widths 3 millimeters, with maxillary incisors 4 millimeters to NA, and the mandibular incisors 5 millimeters to NB. The interincisal angle is 130 degrees. The mandibular plane to SN is high at 40 degrees. The occlusal plane to SN is 20 degrees. Treatment options. How would you treat this malocclusion?